we look at the 20th century, the numbers of people who died from infectious diseases went way down.
A new era of technology. We know that in the cars we drive and the entertainment that we have and the way we travel and the breakthroughs in medical technology. The new antibiotics and antivirals, the cancer medicines that we see coming down the line is sensational.
We didn't have this kind of capacity back in 1918.
This year marks the centenary of the worst pandemic to strike humanity since the Black Death, the Spanish flu. It started out like any ordinary flu. People suffered from sore throat, fever, headache. Then it went on to become more sinister. It attacked mainly those in the prime of life, mainly men. In 1918, there were no antibiotics.
Doctors recommend aspirin.
Really, the only medicine that doctors had was aspirin, the so-called wonder drug.
Make you feel better fast.
It infected 1 in 3 people on Earth. It killed perhaps as many as 100 million people.
The influenza viruses are tough to deal with because they're always changing. Mutations means the existing immunity that we have in our body don't work as well, and it can lead to a pandemic.
Now we are seeing 3 to 5 new emerging communicable diseases with pandemic potential every year. It's not going down. The risk is going up. Faster travel means most of the world is now 1 incubation period away from an outbreak.
The virus was very distantly related to the 1918 pandemic. But in 2009, we saw the spread of this virus move from country to country much faster. We tried to get antiviral drugs out to countries, and we immediately began making influenza vaccines within the first several hours of the virus being detected.
One of the primary causes of death really is when influenza progresses and becomes pneumonia. And that pneumonia can be a virus or it can be a bacteria. The problem is that we're beginning to get resistance to antibiotics. So that protection that we had from the major cause of death from influenza is waning.
Right now, we're in a period in which antibiotics are used by people to grow plants, to grow fish, and they're also used to raise animals. And all of these uses contribute to the development of antimicrobial resistance.
We're not using our antibiotic tools in the most prudent and effective way, and it's become a huge problem around the world.
About 700,000 people die each year. This could go to several millions of people per year over the next few decades.
When you think about how a pandemic grows, it's really a mathematical equation. And the rate-limiting step early in a pandemic is the speed of detection. The same thing as saying, how good is your surveillance system?
Infectious diseases like HIV, pandemic influenza, SARS, MERS, these are all viruses which started in animals.
One Health is to understand the continuity between animals, the environment, and humans, all of a piece.
We need the general public, we need politicians, we need people working in business, we need people working in agriculture, in economics, all to understand that unless everybody joins in, we're not going to beat it back.
In 1918, science was widely considered to have failed. Today, we are much better equipped. In another 100 years, the flu pandemic risk will still be there, but we may also have other weapons in our armory that haven't even been dreamed of yet.
In order to stop a pandemic, every country has got to do what's in the best global interest.
We're going to have the ability to get ahead of infectious diseases, work together, make sure that drugs are used wisely and available to everybody.
Over the last 100 years, we've seen so many advances. If we can harness them to serve our global common good, I don't worry about the next decades.
It's definitely possible. We can do this.